In this chapter, we will discuss more of the concepts of strength training, including the adaptation process, definitions and types of contractions, circuit training, plyometrics, and core training. Adaptation is the change that takes place as a result of the response to a stressor. Hans Selye developed a theory based on this process. This is referred to as the general adaptation syndrome. There are 3 phases to this theory. First, stress is implemented by the strength and conditioning program, which causes a temporary reduction in performance or function as the student athlete experiences fatigue immediately following the activity. Second, through proper rest and recovery, the individual adapts and recovers to the stress. Over time, this improves the body's performance or function. This improved response is often called the supercompensation theory of training. It is through the careful, systematic strength program that an individual is safely able to increase strength and size. However, if he or she doesn't continue with the program, they will return to baseline measures of strength. The muscles respond to strength training in the following phases. During phase 1, the learning process of proper lifting takes place, which enhances lifting ability. The individual may feel stronger, but in fact, there is no increase in size and strength, only increased contraction and blood flow to the muscle. This makes the muscles feel tight and full. In phase 2, the muscle fibers become stronger, but there is still no increase in size. And finally, in phase 3, there begins an increase in size and strength. At approximately 5 weeks, a 23% increase occurs, with full potential of strength and size occurring at approximately 12 weeks, depending upon the program and the individual. Women are sometimes concerned about bulking up with the strength program, but because of the lack of testosterone in their bodies, they need not worry about this. Strength training will define rather than bulk their muscles. In this section, we will discuss the different types of contractions: isotonic, isometric, concentric, eccentric, and isokinetic. Iso means same or constant, while tonic means tension. So during an isotonic contraction, the muscles shorten with varying tension while lifting a constant load. The varying tension occurs, for example, when you perform a biceps curl. There are degrees in the range of motion that seem more difficult than others to lift the weight. Whereas in isotonic movements, there is same tension but changing length in the muscle, in isometric movements, there is the same length but changing tension. In isometric contractions, the muscle contracts fully but without movement of the joint. Concentric contraction shortens the muscle as it acts against a resistive force, like a weight. For example, during a biceps curl, the biceps contract concentrically during the lifting phase of the exercise. During these contractions, the muscles lengthen while producing force. The lowering of the weight back down during a biceps curl is an eccentric contraction for the bicep. Think of this as putting on the brakes. You are basically slowing the descent of the weight back down instead of allowing the weight and gravity to just pull your arm passively down to its original position. Isokinetic contraction occurs when there is the same speed throughout the entire range of motion. This is used with expensive isokinetic machines, popular in physical therapy, but not in fitness gyms. These include hydraulic systems, the Kincom, Kaiser, and Cybex, to name a few. To compare the three types of programs, isotonic movements that occur, for example, in free weights are ideal because you can perform them yourself and don't need the assistance of others, whereas you need assistance in the use of isokinetic activities. Isometrics can be performed anywhere, but isotonics and isokinetics cannot. However, the use of TheraBands is very portable and allows one to perform isotonic exercise. Isometrics allow you to strengthen one specific joint angle, but isotonic and isokinetic exercise allows you to strengthen the entire muscle through a greater range of motion. Circuit training is a creative approach to strength and conditioning. There are 6 to 15 stations that include strength, conditioning, and flexibility exercises. The team or class is divided and assigned a different station. Shorter rest periods are used between exercises to allow a different student athlete to perform the exercise, and longer rest periods between stations to allow student athletes to transfer from one station to the next. The benefits of circuit training are numerous. Team building is enhanced as the team or class works through the circuit together. Encouragement and healthy peer pressure spur the student athlete to do the best. Circuit training also prevents boredom that can occur in traditional strength and conditioning programs, and it can focus on all aspects of strength and fitness. The detriments of circuit training are the inability to do power exercises and Olympic lifts. In addition, proper sequencing is not possible for all participants as they work through the unit. For many years, coaches and athletes have sought to improve power in order to enhance performance. Power is force times distance divided by time. Jumping, bounding, leaping, skipping, and hopping exercises have been used in various ways to enhance athletic performance. In recent years, this distinct method of training for power or explosiveness has been termed plyometrics. Plyo means more, and metric means measure, so the word literally means more measure. Plyometrics describes the method of training that seeks to enhance the explosive reaction of the individual through powerful muscular contractions because of rapid eccentric contractions. Plyometrics utilizes eccentric muscle contractions and is also considered anaerobic. Olympic lifting and kettlebells are popular examples of plyometrics. However, you need to know what you're doing to perform these exercises. If you're not familiar with them, do not use them for fear of injury. The medicine ball, skipping rope, and even sprinting are common examples of power development. The presentation will offer other common plyometric movements as well. An adequate base of strength and power must first be developed before you begin plyometric training. Landing surfaces, good shoes, limited repetitions, base strength, and speed of execution influence plyometric training and injury potential. Focus on the landing as much as the jumping. This is where most of the injuries occur. Don't participate in high-impact plyometric exercises if you have knee or spine problems. Also, be sure you teach proper jumping and landing techniques. Notice the girl in the presentation and observe how her knees are buckling upon landing. She is setting herself up for an MCL or ACL injury. First, practice squats without weight to teach proper hip, knee, and foot positioning. Second, perform low-impact plyometrics focusing on proper landing as much as jumping. And third, initiate a regimented plyometric program following these guidelines. It is wise not to perform too many repetitions in one session. Focus on the quality of movement and speed and quickness rather than the endurance. Split the work into sets with ample recovery in between. For athletes who are new to plyometric work, utilize low to medium intensity exercise with approximately 40 contacts per session. It is wise not to perform too many repetitions in any one session. Focus on the quality of movement and speed and quickness rather than endurance. Split the work into sets with ample recovery in between. Athletes new to plyometric work should implement low to medium intensity exercises with approximately 40 contacts per session. For example, 2 sets of 6 bunny hops would be considered 12 contacts. A similar approach should be taken for upper body plyometric movements. Experienced athletes conducting lower body plyometrics may perform up to 150 to 200 contacts in a session. Refer to this slide for a list of low, medium, and high intensity exercises. You will also have the opportunity to view a short clip of plyometric exercises for the upper and lower body in this unit. Core strength and stability refers to the body region surrounded by the abdominal muscles, the pelvis, the low back, and the diaphragm. The goal of core stability is to create movement in the legs and arms without compensation movement in the spine or pelvis. Boyle also states that the goal of core stability is to allow force to move from the ground through the hips, spine, and scapulothoracic joints without energy leaks. This means that the muscles are contracted and the spine is straight with the shoulders staying in line. Refer to the presentation for a list of core exercises. A comprehensive DVD will also be offered in this unit. Boyle states that most individuals will substitute lumbar extension for hip extension. This is because they lack core strength and have non-mobile hips. Recall the first unit, where we discussed the mobile and stable joints of the body. The lumbar spine function is stability, not mobility, so we don't want to focus on rotational core movements. Instead, we focus on mobility of the hips and the thoracic spine. We also want to conduct a lot of isometric and holds and stabilization before we focus on core movements. Progressions from simple to more complex movements are imperative. The final slide will discuss how to activate the glutes. Boyle recommends that glute activation should be the focus of every warm-up. Refer to the DVD in Unit 1 as a reminder of these mobility drills. Straight leg mini band walks activate the glute medius, and quadruped hip extension ignites the glute maximus. These simple exercises create mobility in the hips, which is imperative in core stability. The remaining portion of Boyle's chapter on the core includes the progression of core stability exercises. Refer to this section and the DVD of core exercises included in this unit.